everyone, my name is Sarah Wright. Today is June 6, 2022. Here's my note card. Here's the back. And today I'm going to be talking about the skeletal system. So the main components of the skeletal system include the ligaments, cartilages, bones, and connective tissue that interconnect or stabilize bones. And the main functions include the protection of blood as well as the protection of soft tissue and storage of minerals. The characterization of bones based off of shape include sutural bones, which are going to be flat and small in shape, and they're going to be in between the flat bones of the skull, and they are also along the sutures. And then we have pneumatized bones, which are going to be hollow or filled with air pockets, and an example of that would be the ethmoid bone. And then we have flat bones, which are going to be thin, and they are roughly parallel of compact bone. And then it's kind of like a compact bone sandwich, where there's compact bone, spongy bone in the middle, and then compact bone again. And some examples of those are the parietal bone of the skull, sternum, ribs, and scapula. And then we have short bones, which are box-like in shape, and they're going to have a compact bone coating, and then a inside of spongy bone. And then some examples of those are the tarsal and carpals. And then we have irregular shape bones, which are odd in shape. They can be flat or rigid, and then an example would be the bones that make up the vertebral column or the vertebrae. And then we have sesamoid bones, which are going to be small, round, and flat bones that develop inside tendons. An example would be the patella. And then we have, lastly, long bones, which are going to be long and slender, such as the femur, as well as tibia and fibula, and then humerus, radius, and ulna. Now looking at the axial and appendicular skeleton, the axial skeleton includes the bones of the skull, which is including the cranial bones and face bones, and then also the thorax and vertebral column. And then we have the appendicular skeleton, which includes the bones of the upper and lower limbs, as well as the pelvic and pectoral girdles. The cranial bones include the frontal, parietal, temporal, occipital, and sphenoid and ethmoid bone. So, like I just mentioned, the cranial bones. Here's the frontal bone, parietal, occipital, temporal, and sphenoid, and ethmoid or ethmoid is in here, and that makes up the cranial bones. And then we have zygomatic, lacrimal, nasal, inferior nasal concha, I think it's vomer, maxilla, palatine, mandible. Then we have the malleus, incus, and stapes. And then in here, up here, we have the hyoid bone. We have, starting with the vertebral column, we have C1 to C7, and then T1 to T11, and then L1 to L5, to the sacrum, to the coccyx. Then we have the ilium, ischium, and then pubis, and those three make up the hip bone. Now moving back up here, we have the sternum, the ribs 1 through 12. This is 1 through 10 here. And then we have two floating ribs, 11 and 12 here. This is the scapula, clavicle, and then we have the humerus. Make sure let's see, it's got to turn around. There we go. So humerus, and then we have the ulna, and then radius. Now looking at the hand here, we have the carpal bones, which include the scaphoid, lunate, trigatrum, pisiform, hamate, capitate, and then the trapezoid and trapezium. And then we have the metacarpals, which are going to be metacarpals 1, 2, 3, 4, and 5. And then on top of those metacarpals are the proximal, middle, and distal phalange. And those are according to whatever number metacarpal it is. So for here, it'd be metacarpal 1, then there is proximal phalange 1, middle phalange 1, and distal phalange 1. Now moving down here, we have the femur, patella, tibia, fibula, and then down here at the foot, let me get a good angle here, we have the tarsal bones. So the tarsal bones are going to include the talus, the navicular, and then the cuboid, and then we have the medial cuneiform, lateral cuneiform, and then intermediate cuneiform, and then calcaneus, and then we will have the metatarsals 1 through 5, and then similar to the carpal bones, we're going to have the metatarsals, then phalange proximal and 1, and then phalange medial 1, and then distal phalange. So I think I said medial, I meant middle, sorry, middle phalange. And then that makes up the skeleton. And then a clinical application of this is I want to be a PA in trauma or emergency medicine, and one of the things I thought of when in relation to the skeletal system is when bones break. Specifically, I want to be in pediatrics, so I commonly think of like when kids break their arm or their foot. And if I do get that, I would need to not only know what bone was broken, but also know the external structures surrounding that bone. And I would need to be able to classify what kind of break it was, like a fracture, what kind of fracture, stuff like that. But I would need to be able to identify the bone and then also be able to stabilize it in order for it to properly heal and not cause any future irritation or injury. So that's one of the main things I think of. Also, including emergency medicine, I think of car accidents, and I would definitely need to know, for example, if someone broke their femur, all of the external structures and tissues that would definitely be affected by a femur break. So that would definitely be an application of the skeletal system. But also in general, the skeletal system is the foundation of the body, so it's essentially critical to know its entirety, not only by identification, but its mechanisms as well, so that surround it. So, thank you.